This evening, we've learned of another confirmed case of the Zika virus here in Central Texas.
This time it is in Williamson County. Health officials there tell us the person contracted Zika during a recent trip to a country where that virus is prevalent. KXAN's Phil Prazen is live in Georgetown with more tonight. Phil?
Well, Robert and Shannon, the good news is the Zika patient here in Williamson County is in stable condition. More good news. The health department here in Williamson County says that all the Zika viruses in Texas have not been locally transmitted. That means the 34 cases we do have in Texas have all came from people traveling abroad and then bringing it back here with them. But this is the latest example of a state trying to catch up to the changing world of infectious diseases. Small and medium-sized county health departments do not have the resources to build labs on their own, so they have to rely on the state health lab in Austin. That lab tests mosquitoes for West Nile, but does not currently test mosquitoes for Zika. John Teal, the executive director of the Williamson County Health District, and 60 other local health departments have asked the state to start testing for Zika.
For Zika, there is not a test authorized for counties like Williamson County or Travis County that where we would be authorized to send whole mosquitoes for testing for Zika. We are limited to sending patients' blood, and even then, the patients have to meet real specific criteria like having traveled to an affected country.
Well, I just got an email from the state health department who says that the gold standard for testing Zika is to monitor and test human patients, not mosquitoes. But John Teal still tells me that it's his hope the state will change that policy and start testing mosquitoes at the health lab in Austin later this summer. For now, Teal tells me it's the best defense to just not get bitten. That means wear bug spray and get rid of any standing water you have in your yard or around your house. Standing water, again, is where mosquitoes breed. But for now, we're live in Williamson County. Phil Prazen, KXAN News.
The number of Zika virus cases in the United States is growing, but it's still low. The Centers for Disease Control confirmed fewer than 500 cases so far. As Phil mentioned, 34 of those are here in Texas. Government spending is rising on efforts to diagnose and fight this virus. And a new test approved today by the CDC could offer a faster way to test for the virus. The test uses urine. Current tests use blood samples, which take longer to test. CDC officials say the new urine test for Zika is not only faster, it may be just as accurate, but they still recommend testing blood as they work to track the disease.
The Hayes County